Did you know that every night, millions of elderly people across Europe and America silently swallow a sleeping pill? And with that small tablet, they begin a slow decline they don't even realize is happening. Sleeping pills, seemingly harmless, legally prescribed, easy to obtain, have become a silent public health crisis among the elderly. Behind the peaceful image of a good night's sleep lies a hidden danger that's growing day by day. Sleep problems are incredibly common in old age. The body changes, brain function slows, hormone levels drop. Add to that loneliness, chronic illness, anxiety, and sleep becomes a nightly struggle. While the world sleeps, many seniors lie awake for hours, battling restlessness and fear. And when they can't sleep, they reach for a pill, desperate for relief. But what they don't realize is, it's a one-way street, and the way back is rarely easy. At first, it's just one pill, then two. Soon, sleep becomes impossible without them. The body starts depending on the drug. They think they're treating insomnia, but what they're actually doing is forcing the body into artificial sleep, a type of unconsciousness that doesn't restore or heal. Worse still, it damages memory, weakens reflexes, and robs them of safety and independence. When sleeping pills enter an elderly body, they slow the nervous system. This makes it much easier to feel dizzy, disoriented, or lose balance, especially at night when they get up to use the bathroom. A simple fall, in old age, can mean a broken hip, a head injury, or even death. Hospitals across the US and Europe report hundreds of thousands of emergency visits every year due to falls linked to sleeping pill use. But that's just the beginning. Long-term use of sleeping pills is also strongly linked to memory loss and dementia. Studies show that elderly people who regularly use benzodiazepines have a significantly higher risk of developing Alzheimer's disease. Over time, they start forgetting their grandchildren's names, their way home, and eventually, how to function without the pill. Worse still, sleeping pills can interact dangerously with other medications. And older adults often take multiple drugs at once for heart disease, high blood pressure, diabetes, depression. When mixed with sleeping pills, the result can be fatal: respiratory failure, irregular heartbeat, or unconsciousness. So why are so many elderly people falling into this trap? Because no one warns them. Doctors may prescribe the pills short-term, but the patients end up using them for months, even years. They're rarely given proper guidance. They often live alone, without emotional support or companionship. They're scared of insomnia, and pills become their only escape. Some governments have taken action. France and Canada now limit prescriptions to just a few weeks and require strong warning labels. In the US, the FDA has issued black box warnings, the highest level safety alert. In the UK, doctors are advised to offer cognitive behavioral therapy instead of pills, especially for seniors. But the truth is, millions of older adults are still using sleeping pills every day, unaware that they're trading their memory, mobility, and years of life for a temporary night's rest. There is a better way, and it doesn't come in a bottle. It's called cognitive behavioral therapy for insomnia, or CBTI. This proven therapy helps people understand how sleep works, identify harmful habits, and retrain the brain to sleep naturally. No pills, no addiction, long-lasting results. And best of all, it's completely safe for the elderly. Lifestyle changes also help tremendously. Light morning exercise, mindfulness meditation, avoiding caffeine or sugar after late afternoon, sticking to a regular sleep schedule, and limiting daytime naps. These simple changes, when done consistently, can make a powerful difference. But the most important ingredient of all is not medication or therapy. It's connection. Older adults shouldn't have to face sleepless nights alone. Support from family, friends, neighbors, and health workers can be more effective than any pill. A phone call, a dinner together, a walk in the park. These small acts of care can bring peace and comfort, helping our elders rest well, without medication. If you know someone who depends on sleeping pills every night, please share this video with them. Help them understand that real rest comes not from a pharmacy, but from peace of mind, healthy routines, and the warmth of human connection. Don't let your loved ones become silent victims of a deadly sleep. Don't wait until it's too late.